Now for electrolyte imbalances. In this video, we're going to be breaking down the top tested causes and critical manifestations or signs and symptoms of how our clients present when electrolytes are out of balance. And trust me, these topics love to show up on nursing exams and even the NCLEX. Now, some imbalances can be downright deadly, so just remember this test tip. The most deadly conditions are typically the most tested conditions, since the main goal of nursing school is to create safe nurses who know how to spot when something isn't right. So before we break this down, let's review our main electrolytes and what they do in the body in this fun video segment.
We're here at the red carpet known as the red blood vessel, and oh boy, it's a busy one. We're all here just anxiously awaiting and anticipating the presence of the annoying electrolytes. And oh my gosh, here they come. First on the list is king potassium at 3.5 to 5.0 microequivalents per liter. He's the king of action and contraction, especially in the heart and skeletal muscles, keeping each muscle cell charged or basically polarized via the sodium-potassium pump. His slogan is, "I'm the king of action and contraction, baby." He's obtained through your diet via fruits and green leafy vegetables, absorbed in the intestine and excreted out of the body and into the body via the bowels and the kidneys. He is one cool cation, King Potassium. And up next is Miss Salty Sodium, ranging from 136 to 145. Bloated beyond belief, always followed around by the water paparazzi because where sodium goes, fluid flows. Now, she is also a major cation in the extracellular fluid, that fluid outside the cell, obtained in the diet usually through salty snacks like canned food, processed meats, fast food, or basically anything a nursing student would eat. Let's be honest, you know it's true. Absorbed in the small intestine, excreted by the kidneys, her slogan is, "I'm a leader, never a follower. Bloated is the new black. Be true to your salt. Salt happens. But first, let me take a salty." Sodium's two main job functions are to maintain blood volume as well as blood pressure, and also to keep pH balances. She's kind of a big deal. Sodium's regulated by the ADH hormone, antidiuretic hormone, also known as ADH2O, because it holds water in the body. Aldosterone hormone we call aldosterone, the security bouncer in the kidneys, holds onto fluid by basically holding salt back. And lastly, she works very closely with potassium in the sodium-potassium pump, which helps energize every cell in your body and also buffers out acid-base imbalances. Now that was kind of quick. We go into full detail in the full videos at simplenursing.com, so please don't worry. Miss Salty Sodium, over here, please, please. We have some questions about your recent takeover of the Cup of Noodle Soup Corporation. What is your relationship with Mr. King Potassium? Sources tell us sodium and King Potassium are deeply involved in what is known as the sodium-potassium pump affair. Up next is Mr. Law & Order himself, Magnesium, weighing in at 1.3 to 2.1. He's the new sheriff in town, Big Magnesium, here to keep law and order in the muscles of your body. Without Mag, we have complete chaos, complete disorder, so obviously his slogan is, "There's a new sheriff in town. Do you feel lucky, punk? Well, do ya?" Obtained through the diet via the spinach, almonds, and yogurt, absorbed in the small intestine and excreted by the kidneys once again. He's a man with many jobs, but his main job function is to keep law and order in the muscles via protein synthesis, nerve function, as well as blood sugar control. Now, magnesium loves to flirt or stimulate the parathyroid hormone, which regulates calcium levels inside the cell. So obviously his BFF, best friend forever, is Mr. Calcium. Hence, he is required for calcium and vitamin D absorption, which fights tooth decay on the daily by binding calcium to that tooth enamel.
You mean right here or right here?
I love you, Mag. Up next is the cocky jerk himself, Cocky Calcium from Muscle Beach, California, weighing in at 9.0 to 10.5. He's the most abundant cation in the human body, 99% found in bones. His slogan is, "I'm bad to the bone, brother." He's obtained through the diet from fruits and veggies, almonds, and dairy products, but mainly green leafy vegetables. Absorbed in the small intestine, excreted by the kidneys. Now, sources tell us he has a love affair with vitamin D, some sort of absorption web of lust and lies. Now, since he's a strong dude, obviously his main job functions is to make things strong. So guys, remember the 3 B's. strong bones, strong blood, and strong beats. Strong blood from facilitating blood clotting, and strong beats in the heart. Anyways, he helps build job functions for his best bud, his BFF forever, magnesium. Often when magnesium is low, calcium fills in for his best bud's absence as treatment of choice. Man, what a good friend, filling in for his best bud when he's away. Lastly, he is regulated by the 3 hormones in the endocrine system. The PTH, parathyroid hormone, which increases calcium concentration in the blood. The calcitonin hormone, which does the opposite and decreases that blood calcium by putting a ton of calcium into the bone. Get it? Like calcitonin, a ton into the bone. And third one, calcitrol, which controls the release of calcitonin. Basically, it reverses that ton of calcium in the bone and releases it back into the blood. And up next, wait, could it be? Oh dear, it's cocky calcium's worst enemy, friendly frat boy Phosphate. At 3.0 to 4.5, he's calcium's worst enemy. Now, calcium's always ripping on this guy, bullying friendly Phosphate because he's so darn friendly. They're complete opposite and always work inversely. So whenever calcium's high, well, phosphate is low, and vice versa. They don't get along like at all. And I think honestly because it's like cocky calcium's all wrapped up in himself being like a big jerk, and phosphate's all like, bye Felicia, absorbed in the small intestine and excreted by the kidneys. Phosphate's main function is to help bones and teeth formation and repair cell tissues. Lastly, phosphate is regulated by the same things that regulate calcium. So the PTH, parathyroid hormone, which controls calcium. Remember, calcium and phosphate work inversely, so if one's high, well, the other one's low. Last but not least on our list is Miss 4-eyed Chloride, leveling in at 98 to 106. She's Miss Salty Sodium's forgotten sister named Chloride. Now, everyone calls her 4-eyed Chloride because she's a super nerd, always behind the scenes and always going unnoticed, kind of like a ghost. She's always following around her super salty sister star and always in her shadow, secretly jelly of all her superstar status. Almost like the drama a reality TV show family would have. What was their name? It's that famous family's name, you know, like, was it, okay, Bardashian, Sardashian, Klardashian? Osborne's, that's what it was. She's obtained through the diet in the same places that salt is, because obviously she follows her big sister around. So guys, seaweed, sea salt, table salt, and tomatoes and olives are basically anything that's processed. Absorbed in the small intestine and excreted from the body into the potty via the kidneys, chloride's main function is to help her sister salty sodium. So chloride functions in a very similar way sodium does, maintaining the blood volume, blood pressure, and the pH balance of your fluid. All right, guys, that wraps it up here for Magic Mike. Michael, back to you in the studio.
Now for the electrolyte imbalances. First up, we have potassium, 3.5 to 5.0. Once again, the function of potassium, it is priority, since it pumps the heart and muscles. So for hyper, think high. Hyperkalemia is over 5.0. And the manifestations to know for your exams is in the heart, we have high pumps. So the number one thing is peak T waves with ST elevation. Number two, with severe hyperkalemia, we see VFib or ventricular fibrillation and cardiac arrest, as well as number three, hypotension and bradycardia, as the heart cramps up from overpumping. Now in the neuromuscular or musculoskeletal, we see increased DTRs, those deep tendon reflexes, as well as number two, paralysis and paresthesia, that numbness and tingling in the extremities. And number three, muscle weakness, or a general feeling of heaviness. And for GI, just think high pumps. We have diarrhea and hyperactive bowel sounds. Now the causes for hyperkalemia is renal failure as well as low aldosterone. So the memory trick is AL. A for add sodium to the body, and L for loses potassium. So with low aldosterone in the body, we lose less potassium within the cell. And now potassium stacks up, causing hyperkalemia. Now on the other side, for hypo, think low. Hypokalemia is below 3.0. So the manifestations to know. In the heart, we have low and slow pumps. So number one is flat T waves with ST depression and a funky little U wave. For neuromuscular, just think low and slow. Shallow respirations is the most deadly here, as the diaphragm muscle used for breathing is low and slow. And number 2 is decreased DTRs, those deep tendon reflexes. Number 3 is the muscle cramping and the flaccid paralysis, or paralyzed limbs. And for the GI, just think low and slow. We get number 1, constipation, with hypoactive bowel sounds, with hypokalemia. And number 3 is a big one, paralytic ileus, basically a paralyzed intestine. Now this is priority because it's a huge risk for an SBO, a small bowel obstruction. Now for the causes. Fluid loss is the main cause of nearly all electrolyte depletion. So think fluid loss means electrolyte loss. Or just say,
where fluids flow, electrolytes go.
So just think fluid loss here. Mainly diarrhea and diuretics drain fluid from the body and into the potty. But we also have a diet that is low in potassium, DKA, and aldosterone. So for DKA, diabetic ketoacidosis, clients have very thick sugary blood, basically high blood osmolality or high blood thickness. All this blood thickness draws fluid out of the cell to balance the fluid concentrations. So with this osmotic water movement out of the cell and into the vascular space, or the bloodstream, potassium also moves into the extracellular fluid. And lastly, for aldosterone, our good old friend here, we know that he adds sodium to the body and loses potassium. So we get low potassium with too much aldosterone. Now moving on to sodium, 135 to 145. We know that sodium swells the body and helps to maintain blood pressure, blood volume, and pH balance. So for hypernatremia over 145, the critical manifestations to write down here. The body will be big and bloated, as fluid is drawn out of the cell and into the body. Naturally, cells shrink with this hypertonic state of blood serum. So number 1, we see edema, a very swollen body. Number 2, flushed red and rosy skin. And number 3, an increase in muscle tone. Be sure to write that down. Increased muscle tone. And number 4, a swollen dry tongue. And lastly, number 5, nausea and vomiting. Now for the causes. Low ADH, that antidiuretic hormone, which I call ADH, adds the H2O to the body. So without it, clients get DI, diabetes insipidus. So just think DI as dry inside. Since ADH is not adding to H2O, clients diurese fluids in DI, like up to 20 liters a day. Now that's a lot of urine. So they get really dry inside and have really high and dry lab values. Another cause is rapid respirations, basically breathing too quickly. They blow off a lot of fluid from insensible losses. And watery diarrhea. Now this is a weird one, since usually where fluids flow, electrolytes go, right? But in this case, diarrhea makes the body dry, so we get high sodium. And lastly, a loss of thirst. Clients with difficulty communicating or ambulating may be unable to express thirst or obtain access to water, which leads to further dehydration in the client, leading to a hypernatremic state via hemoconcentration. Basically really thick blood. Now switching gears to hyponatremia, below 135. The big one is low and slow inside the brain. So number 1, the big one to write down here is a headache. Think cerebral edema, big brain swelling. Number 2 is mental status changes from the cerebral edema. And lastly, number 3 is a seizure or seizures and coma from that brain swelling. The critical sign here is cerebral edema. Now, neuromuscularly, we have low and slow, so we see fatigue and cramps. And for the respiratory system, we have a respiratory arrest. Very critical sign. Now, the causes can be very tricky here. So the 2 main causes is hemodilution, where we see diluted labs, or electrolyte depletion. For example, sweating or excessive water intake when running in extreme heat. Huge test tip there. And even SIADH, where we have excess ADH, which adds to H2O, basically adding too much water to the body, which leads to dilution of labs. And for electrolyte depletion, we see vomiting and diarrhea, diuretics and diuresis that drains fluid from the body and into the potty, and even a diet low in salt, and even low aldosterone, because as you know, aldosterone is needed to add sodium to the body, and the L is to lose potassium. So with low Al, this means we can't add sodium, resulting in hyponatremia, that low sodium. Now moving on to chloride, 97 to 107. As you know, it's sodium's sidekick, and the functions are very closely related to sodium. So it maintains blood pressure, blood volume, and pH balance. And it's not typically highly tested. So hyperchloremia is nearly the same as high sodium. We see a swollen dry tongue as well as nausea and vomiting, and alkalosis from all the vomiting. And for hypochloremia, again, it's nearly the same as low sodium. We see fatigue and muscle cramps, but really fever is the only difference here. Now moving on to magnesium, which is highly tested, so be sure to pay attention here. 1.3 to 2.1. As you know, magnesium mellows the muscles. So with hypermagnesemia over 2.1, the manifestations to write down in the heart is high mellow, basically really mellowed out heart muscles. So number 1, we see heart block. And number 2, hypotension and bradycardia, basically low blood pressure and a low heart rate. And for the DTRs, the deep tendon reflexes, just think high mellow. So hyporeflexia with decreased DTRs. And please be sure to write that down. A lot of students get this wrong on exams. And for the lungs and GI, once again, think high mellow. So depressed respirations, or basically depressed respiratory rate, and hypoactive bowel sounds. So just think super mellow here. Now for the causes. Renal failure, alcoholism, and malnourishment all lead to high magnesium. Now on the other side, for hypomagnesemia, below 1.3, the manifestations to know for the heart, just think low mellow. Basically very, very excited. So number 1, the big one to write down, is torsades de pointes. This is a funky heart rhythm that looks like a tornado and eventually leads to VFib, ventricular fibrillation, that will kill the client. But really the number 1 tested is torsades de pointes. So please be sure to write that down and know what this rhythm looks like. And next is DTRs, low mellow, so super excited. We have hyperreflexia, increased DTRs. And the main causes to know is Crohn's disease and celiac disease, which are 2 GI problems that limit the absorption of magnesium. Okay, now for the big guy, calcium or cocky calcium, 9.0 to 10.5. Remember, calcium contracts and calms the muscles here. So as stated before, the 3 big calcium functions. It keeps the 3 B's strong. Strong bones, strong blood or clotting factors, and strong beats, and we're talking about heartbeats. And it also keeps the teeth strong, those little pearly whiteys. Now for hypercalcemia, over 10.5, the manifestations to write down, just think high calm. The organs are too calm and don't want to do their job here. So number 1, we see kidney stones with moans and groans, also called renal calculi. Because as you know, the kidneys are supposed to filter the blood and wash out waste, but they're not doing their job, so we end up with kidney stones. And number 2 is constipation. The GI tract is way too calm here. And number 3, we have bone pain, as calcium is leaving the bone and going into the bloodstream, causing high calcium. And number 4, we see severe muscle weakness and lethargy, basically too much calm. Now for the causes. As you know, calcium needs vitamin D to be absorbed and loves magnesium, as they also help each other absorb. And once again, as you know, calcium is controlled by PTH, the parathyroid hormone. So in hyperparathyroidism, we have high PTH, which leads to high calcium inside the blood. Now, 2 other causes is cancer as well as immobility. But really the big tested one is hyperparathyroidism. Now moving on to hypocalcemia below 9.0. So for the manifestations, just think low calm, basically super excited. The number one to write down is the T, Trousseau's sign. We see a twerking arm when a blood pressure cuff is applied on the arm, as well as tetany, basically muscle spasms all over, including the hands and feet and even spasms of the voice box. So please be sure to pause the screen and write down the highlighted ones here, as these are the most tested. Now the second most tested is the C, Shavastic sign, or just Vostok sign. This is the cheeky smile when stroking the side of the face. So clients will have a little smile when touching or stroking the side of the face. So please be sure to write down the T's and the C's for hypocalcemia. Now third is diarrhea. We have very excited bowels. And number 4 is the weak B's. Weak bones lead to fractures. Weak blood clotting leads to risk for bleeding. And weak beats leads to cardiac dysrhythmias. But once again, the most tested are the T's and the C's here. Now for the causes. Hypoparathyroidism, we have low PTH. So this leads to low calcium inside the blood. And a big one here is renal failure, huge test tip, also known as chronic kidney disease, CKD. Clients typically end up in hypocalcemia due to the retention of phosphate, causing hyperphosphatemia, high phosphate, as the kidneys, the washer machines of the body, can't clean the blood, resulting in high phosphate accumulation. So the big test tip to write down is that calcium and phosphate work opposite from one another. So every time phosphate is high, calcium is low, and vice versa. When phosphate is low, then calcium is high. So please be sure to write that down. Now moving on to phosphate, which we just talked about here, 3.0 to 4.5. Remember, it has an inverse relationship with calcium. So once again, if calcium is high, then phosphate is low. And if calcium is low, well, then phosphate is high. Kind of like a seesaw. When one goes up, the other goes down to balance each other out. So phosphate also helps with the bones and teeth formation. But really the most tested is the inverse relationship with calcium here. So with hyperphosphatemia over 4.5, just think low calcium signs here. So number 1, just like hypocalcemia, we have Trousseau's and tetany. Number 2 is Shavastic's, and number 3 is the weak B's, bones, blood, and beats. And once again, the causes, as we just mentioned, renal failure, a big test tip, chronic kidney disease. So once again, kidney failure retains high levels of phosphate, causing hyperphosphatemia. And the test tip to know, once again, is when phosphate is high, well then calcium is low. Always opposite of one another. Now switching gears to hypophosphatemia, below 3.0. So once again, think high calcium signs. So the number 1 sign is kidney stones with moans and groans. Kidney stones is also called renal calculi. And number 2 is constipation with bone pain and severe muscle weakness and lethargy. And just like high calcium, the causes are similar. Hyperparathyroidism, we have high PTH, which leads to high calcium in the blood, making phosphate low. And 2 other causes is genetics and cancer.
Electrolytes are that disco dance party of the body that energize your brain, nerves, and muscles. Homeostasis is the body being in balance and all the systems within normal limits. Therapeutic range was that range at which a substance like medication is working its best, not too toxic and not too least effective. Our key electrolyte players are potassium at 3.5 to 5.0, salty sodium at 136 to 145, cocky calcium 9.0 to 10.5, magnum magnesium 1.3 to 2.1, phosphates at 3.0 to 4.5, and chloride at 98 to 106. Now the memorization trick, write these values out 10 times before and after daily studying, the week before your test. This will help you huge and you'll thank me the day of your test. Now, foods rich in electrolytes, it's always going to be fruits and veggies, guys. So for potassium, you'll have bananas and green leafy veggies like spinach. Sodium's a little different story. You're going to have table salt, canned foods, processed meat, cheeses, fast food, pretty much anything you're eating currently right now in nursing school, as well as spices or salad dressings and sauces. Basically anything in a can or package. Magnesium, you'll have spinach, almond, yogurt, and again with the green leafy veggies. Calcium, you'll have milk and cheese, almonds and oranges, as well as green leafy veggies. Guys, it's not just dairy. Green leafy veggies are actually a better source of calcium. Now, phosphate, your three wise men, are your dairy, meats, and beans. And chloride is so simple because it's found mainly in salty foods, but also in main ingredients like salt substitute, along with potassium too. Now, what depletes electrolyte? Well, remember, where fluids flow, electrolytes go. So VPPS, vomiting fluid, peeing fluid, pooping fluid like diarrhea, and sweating fluid. Hemoconcentration rhymes with dehydration, so high and dry, high lab values and dry body. Hemodilution is low and liquidy, that diluted lab values. So low lab values, liquidy body, seen with our fluid volume overload patients.
All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download